So I'm back again with another video as promised, explaining my procedure in doing a UFE. If you watched my first video, you kind of learned how I discovered that I had a fibroid that was a little larger than a grapefruit, and it had my uterus feeling like I was the size of someone who may have been about 8 weeks pregnant. No fun. And also, I realized that my stomach was, bulging out. And no matter what I did, how many sit-ups, how much I worked out, it would not go away. So, that was another red flag of me learning that something is wrong. And, my first video was basically stressing checkup, checkup, checkup. And I, again, stress the importance of having a checkup, doing a health screening, because those are very vital to our everyday living. So please, if you're noticing any changes in your body, listen to your body and go get a checkup. I can't stress that enough. So let me go ahead and kind of go into what happened in doing my procedure. So basically what they have you do is they want you to come in at least 3 to 5 days prior to your procedure so that you can do your consult. Once you schedule your consult, they'll show you a video. Video basically shows the procedure itself, how it's done, what takes place, and they kind of give you a brief overview of, what to expect. They give you a cocktail of prescriptions, and I do literally mean a cocktail of prescriptions. But what they want you to do is do a cleanse. They want you to completely be cleansed out. So they tell you to pick up some Colace, and it's either Malox or milk of magnesia that they want you to take along with the Colace as a stool softener, so that it'll be easier on your cleaning. And they also want you to have that for after your procedure as well, to prevent constipation. And that's a part of your that'll be a part of your daily routine in your recovery time. And so they want you to take off for like 2 weeks. I didn't take off for 2 weeks because I didn't feel the need. After a week, I was good. After 4 days, I was up and moving around and kind of doing things as normal, but basically kind of taking it easy. Nothing strenuous, no heavy lifting or anything like that. So, but I was okay, and I did go back to work, and I'll explain to you how that, happened, or how that affected me going back to work at that time, at the end. But, excuse me, on the day of, I go in, they put you on the little patches, they put the patches all over your body. They hook you up to the machine, and they do a test. They do a test basically testing your heartbeat. They stop your heartbeat, and they want to see how fast your heartbeat will come back. So they take these 2 fingers, they apply it to your wrist. It's really, really, really hard pressure that they push down on your wrist really hard, stops your heartbeat. And you can monitor it yourself as, looking on the screen. But they push it down really, really hard. They stop your heartbeat, and then they let go, and they want your heartbeat to come back rapidly, beating rapidly. For me, didn't happen that way. So for me, they did the test, stopped my heartbeat, and it came back, but it was a slight delay. It wasn't an immediate boom, 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 boom. It was a boom, 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 and and it picked up. So that wasn't good enough for them. They didn't want to do that. And they tested, because when they go in, because the procedure is actually going through your wrist, the veins in your wrist. Now, ask me why, I don't know, but that's the way they do it. And they want to make sure that the heart rate is up when, while they're in there through your wrist. So because they couldn't go through my wrist, they ended up having to go through the middle of my arm. They found the veins there, did the IV there, and we were good to go. So they take you to the back. At this point, we're in the operating room. Doc comes in. Hey, this is what we're going to do. We're ready. We're about to get started. They give me the anesthesia, and I'm out. Now, mind you, I wasn't completely out. I could still hear some conversation. I may not have been able to make out exactly what was being said, but I could still hear. And I could talk. And so as I'm kind of going out, I can tell that they were shaving my vaginal area on one side. Now, mind you, I did shave, but they wanted it to be completely bald in that spot, because they had to put another patch there for the monitoring. So they will do that. They gave me blankets. It was really, really cold, so they gave me several warm blankets, and I'm very cold natured anyway, so the blankets were perfect. They were on point. And so they did that, and it's party time. We were ready to go. They were kind of talking to me, making sure that I was okay, And I could feel the fluids kind of going through my veins. It wasn't hurting or anything like that. No pain, no pressure, no, you know, it was okay. And that was kind of pretty much the gist of it. I think I may have kind of gone out, and all of a sudden I feel this burning sensation. The burning sensation was in my vaginal area, and it was a true burning sensation in my vaginal area. And I did, you know, hey, excuse me, I'm feeling this burning in my vagina. Is that normal? And you know, they kind of laughed and they're like, yes ma'am, that's normal. It will only last a few seconds. And they were correct. It only lasts maybe about 10 or 15 seconds. But the point that I felt that in my vagina area, yeah. But all was well, everything went okay. And the next thing I know, I was in recovery. Woke up to my family, you know, everybody was there. And I wasn't in much pain. Doc came in, hey, you're looking good. You're looking better than most patients I've had in a while, you know. And I'm thinking, okay, well, what was different for them? And I think for them, they were in a whole lot of pain. And, you know, I think it was, I don't know, I think, you know, uncomfortableness. But other than that, you know, I can't see what else could have gone wrong or could have been, you know, bad other than the pain. But I wasn't in very much pain. I guess I still had the meds on me. The anesthesia hadn't worn off or anything like that. And I think I had a little pain in my left side. For some reason, that left side, it was very uncomfortable. But it wasn't any excruciating pain. It was painful, but nothing, you know, that bad. And so I finally got released. They gave me a list of, you know, things to follow, how to take my meds, what time, things like that. And again, they stressed the colace and the milk of magnesia. But for me, I was still constipated. And I think my problem was I wasn't drinking enough water. So I ended up having to take Dulcolax along with, you know, that because I couldn't go. I was literally, like, seriously constipated. Drinking more water, I took some, I was drinking lemon water. And I ended up having to take some, Miralax. I took some Miralax, and that helped, and it kind of flushed it all out. I couldn't eat anything that first day. I think the second day I had some like eggs and spinach or something like that, something very light. I didn't just kind of go, you know, all in with the eating because I really didn't have an appetite, to be honest with you. But other than that, continue to drink more water. The pain medication that they give you, it didn't really work for me as far as helping the pain, because once that anesthesia wore off that next day, it was on. That pain, it wasn't like, oh my God, pain, but it was, oh my God, pain. And so I ended up having to take ibuprofen because I slept off the pain, basically. And then I was having to take it, you know, more than I wanted to, and I didn't want to be addicted to those meds. So I took some ibuprofen, and it helped. It helped me out. And I kind of stopped on the fourth day, I believe. I didn't take the pain pills at all. I just continued to take the ibuprofen, and the pain was actually kind of subsiding at that point, so I didn't really need that many, or to take it every 4 hours as recommended. And so I was okay, and I was kind of moving around more, and so that's why I felt like I didn't have to be off for 2 weeks. Slowly kind of moving into my activity, as I stated, but nothing serious. Get your rest, stay in the bed. Well, it'll make you stay in bed because you're so uncomfortable. But, you know, I tried to sit up and try to, you know, kind of regroup. But it's a little difficult, I guess, and that's with any procedure that you may have. But for the most part, I would recommend this to anyone who's considering having it. It helped me. It's like a lifesaver for me. And I say that because not only is it helping, you know, my stomach to go down, but my cycles, when I say a lifesaver, my cycles are amazing. Okay. I had my first cycle when I went back to work. I went back to work a week following the procedure. After I went for my follow-up. They tell you to come in for your follow-up for a week. Everything, they didn't really do anything. They just really asked questions. And I guess the answers that I provided were on point. So there was no need to kind of go in and check anything. Everything was okay. And so they kind of tell you, if you feel it necessary to make an appointment for something that you're having a problem with, feel free to call them, back. They were open to whatever it is that I needed done, or, and they basically gave me the okay to resume my normal activities. All was well. I go back to work. Now, when I went back to work, I guess it was very, I guess me sitting up for that long period of time was kind of, maybe hard on my body, because I was very uncomfortable. But I believe that was around the same time that my normal cycle would come, and I believe I was having a cycle, because the pain was just, it wasn't like cramping pain, but I was so uncomfortable. But my heating pad, I took my heating pad with me, and when I tell you that heating pad was my best friend for that week, please, if you don't have one, invest in a heating pad. That heating pad saved me, and it made me feel very comfortable, and it helped ease the pain. So go ahead and get you a heating pad if you don't have one. It will be your best friend. But that was the first day. Now the next day, I took my pain meds, and I was good from that day on. So again, I didn't feel the need to take off for 2 weeks. If you want, I guess you can. I guess maybe it will depend on the person. It may vary from person to person. But other than that, my cycles are the bomb. They were usually lasting about 2 weeks. But now it's 5 days, like a normal cycle. And it's not that heavy flow. If I sit down and stand up, there's no waterfall as it used to be. I'm good. I may have used, no, I didn't use any tampons. I used to use tampons a lot, both pads and tampons. I didn't have to use any tampons. I use regular pads, and I'm good to go. I can actually tolerate being around someone now. I've had 2 since the procedure, and the second one was, I guess, like the normal one. The first one, I guess, if you will. Because I'm not sure if the week that I went to work, I'm not sure if that was an actual cycle, but there was the time that I was supposed to have a cycle. But, as far as the fibroid, eliminating itself from your body, you kind of feel the, I guess it coming out, and it will do that. And, you may want to invest in some panty liners or some thin pads or something like that, because like they said, it takes about 3 to 4 months for it to completely be gone. And they do warn you that that 3rd or 4th month, I guess that may be like the last of it. You'll feel there'll be a big glob of something eliminating itself through your vagina area, and that will probably be the last of it. So don't be alarmed if if that happens. They do want to let you know that it will happen. But other than that, all is well. Life goes on. I'm here. I'm happy. It worked out for me. So again, if this helped someone who, like I said, may be on the fence about possibly having a UFE, if you have questions for me, feel free to comment below. I will gladly answer your questions. And hopefully you will allow me to continue to help you up and share my experiences with you guys. And whatever I learn, I'm glad to share it with you guys. If it's anything that I can do to help you, trust me, I don't mind. I want to be your supporter, a part of your support system, and let you know that it's okay. Let me be your motivator to motivate you to go get a checkup. Listen to your body. I can't stress it enough. Go get checked out. So until next time, I will talk to you later. Feel free to subscribe below and hit that like button. And au revoir.